So the reason that I am here on Facebook Live today is because I wanted to do a quick video about massage and other self-care during COVID-19. So I've gotten a few inquiries from clients and patients recently about whether or not I am doing massage at all. And I can see that there is some concern out there still about whether or not folks should be getting massages. And so I wanted to talk a little bit about my thoughts on these things. So, of course, amidst all of this, one of my first thoughts has been whether or not I should be giving massage at all. I did quite a bit of research way back in March to see about getting some masks made for my clinic that would be safe for both me and for my clients and patients to use. And that resulted in me getting involved in my side project, the Bloomington Mask Drive. And since then, my business here at Patient PT has been a little bit up and down. And of course, while we were all still under the shelter-in-place restrictions here in Indiana, things were very slow. And I just wanted to do a little bit of talking about why it's important to continue to be careful, but why I also feel comfortable as a medical professional doing massages now here in my clinic. So as a medical professional, I know that there is no perfectly safe world out there right now, regardless of whether or not we might like for there to be. And I've hesitated to talk specifically about massage here at Patient PT because it's one of those services that has been subject to a fair amount of ridicule on the side of folks who are really concerned about reopening various businesses as a result of restrictions in place on COVID-19, but particularly self-care services like massage and haircuts and manicures and pedicures and stuff like that, that a lot of us tend to turn to in times of stress for a little bit of stress relief, have been kind of made fun of. And there were, of course, a lot of folks who were protesting the shelter-in-place restrictions really early on because they wanted to go and get haircuts and stuff like that. And so it's not a subject that is without controversy. And being that my co-founder Nola and I over at Bloomington Mask Drive already faced quite a bit of pushback with regard to our mask drive, especially early on in this bizarre year. I really did not want to take on another super complicated topic like that directly in relationship to my business right away. So that's a big part of the reason that I haven't said much about massage up until now. But at this point, we are over 5 months into the US's COVID-19 local epidemic here, and it's been going on worldwide since late December, early January. And it looks like there's not necessarily any end in sight, but there has been a lot of new research coming out recently that has made me feel better and better as the days pass about the various policies and procedures that I put in place 5 months ago, both for operations here at Patient PT and over at Bloomington Mask Drive for in-person volunteer operations. And so there was quite a bit of research already when all of this started, but a lot of it was coming from various Asian countries, and a lot of it was really only coming out in medical journals. And so it wasn't really very widely known, a lot of the fine details of how to cope with a pandemic like this. But in the intervening months, a lot of new research has been coming out. A lot of it is coming from researchers here in the United States, which makes it a little bit easier to understand and be kind of more specific to the audience and the understanding of how healthcare and wellness things work here in the United States. But there have been new research studies coming out over the last couple of months on everything from what type of fabric mask is the most effective for controlling the spread of COVID-19 to contact transmission rates that is being, less likely to contract COVID-19 from spread on surfaces. And even the type of detergent that we should be using to wash our masks to prevent that pesky mask acne, also known as maskne, which, by the way, is unscented, sort of for sensitive skin detergent. That's what we've always washed our masks in at Bloomington Mask Drive, because I happen to have very sensitive skin. And so I knew that a lot of folks probably would be sensitive to those sorts of things. But regardless of all of that, well, really because of all of that, I feel very safe and confident in giving massage treatments here at Patient PT, just like I did before the COVID-19 pandemic. And of course, I offer telehealth visits for folks who are physical therapy clients, and I would even do telehealth visits for folks who want some tips on how to do massage for their partner or on themselves to try to manage pain during this time, because we all kind of need all the help that we can get. But when it comes to massage, I think that there are also still a lot of people out there who kind of wish that they could go for a massage, or they've been thinking about going to get a massage, and they are wondering themselves, should I get a massage? Just like I was wondering if I should still be doing massage. And I wanted to say to those folks that if you are feeling stressed out, if you're dealing with some pain and you would ordinarily go and get a massage for it, and you are feeling safe enough to go into other indoor spaces, I think that you should also feel safe coming to get a massage here at Patient PT. I have been doing temperature screens and wearing a mask here in my clinic for months already. I do UV sterilization in between every client and patient. I use fresh linens on my table and my head cover for every patient and client. And I also sanitize all the surfaces with antiviral, antibacterial wipes that come into direct contact with folks in between clients. And I'm still screening my own temperature and monitoring myself for symptoms every single day. So I do feel that I can safely offer massage to clients and patients right now. And so if you have been holding out and wondering if it is really the responsible thing to do, and especially if you are feeling really stressed out or you're really got an achy spot that you'd like to get some attention on, I want you to know that you're at Patient PT, just doctor of physical therapy. That doesn't mean that I'm too good to still do massages. My clients and patients will tell you I'm still pretty darn good at it, and don't feel bad about booking those appointments, because I do make it a little bit on the expensive side, given that I've got all of that additional training, and I can virtually guarantee that you're going to get one of the best and definitely best informed massages available in the Bloomington area. So I just wanted to let you know I've got all of my pricing and a form to request an appointment on patientphysicaltherapy.com. And you can also call or text me at 812-558-0708 to schedule that visit.